All right, good afternoon, and thank you for joining us today for the COVID-19 Vaccine Town Hall for CHWs on bivalent boosters. My name is Dina Pimenova. I'm the Senior Project Coordinator for the NYU Langone Community Health Worker Research and Resource Center, housed in the Department of Population Health at NYU School of Medicine, and supported by the NYU Langone Community Service Plan. Today's event is co-sponsored by NYU Community Engagement Alliance Initiative, NYU CUNY Prevention Research Center, and the NYU H&H Clinical and Translational Science Institute. Next slide, please. Before I introduce our speaker, I would like to review some housekeeping. Everyone is on mute. You can enable or disable closed captioning by selecting live transcript at the bottom of the screen. The chat box is open for comments and sharing of resources. If you are trying to reach all attendees, please select everyone, not just hosts and panelists. We ask that you please use the Q&A box to submit questions to the speaker, and we will have time to answer as many questions as possible during the Q&A portion. The slides and the recording will be made available. I will email those out as soon as possible, and please be sure to fill out the poll at the end. Next slide. This webinar is geared primarily towards community health workers and frontline staff working directly with community members. We will first have a presentation on DOHMH's progress in their efforts to address vaccine inequities in New York City, what is different about the newly available bivalent boosters, and why it's important to get the booster and where to get one. This will be followed by a Q&A. Today, we are excited to welcome back Dr. Olusimbo Ige. Dr. Ige is the Assistant Commissioner for the Bureau of Health Equity Capacity Building at New York City's Department of Health. In this role, she works to increase capacity and readiness of community partners and other institutions to address health inequities across New York City. She also leads the COVID-19 community and partner engagement efforts to ensure equity in access and uptake of vaccines by all New Yorkers. Our Q&A moderator today is Gurvinder Singh. Gurvinder is a community health representative in the Department of Population Health at NYU School of Medicine. He has worked on various projects, including the Diabetes Research, Education, and Action for Minorities, or the DREAM Initiative, the Mediators of Atherosclerosis in South Asians Living in America, aka the Masala Study, the New York Community Engagement, or SEAL Alliance, and CDC's Project Frontline. Gurvinder does outreach in some of New York City's lowest vaccinated zip codes to spread the word about the COVID-19 vaccine. In addition, he has a bachelor's degree in computer science. And with that, Dr. Ige, take it away.
Hello, everyone, and good to be here again. Thank you very much for the opportunity to participate in the conversation, and thank you everyone who stopped by to get some updates on all things COVID, particularly the new updated booster. So if you're like me, we are all tired of COVID. It's now 3 years in the works that we've been dealing with COVID, but the good news is we now know what works and we have tools that we didn't have before. So there is a lot to celebrate. So I am Olusimbo Ige, and today I will be focusing on the bivalent booster update and the things you need to know as a frontline worker, working with the community, how to respond to answers, etc. So let me start with, is COVID still a concern? If you look around you on the subway, walking on the streets, you may be tricked into believing that there is no more COVID, but that's not true. It is true that things are much better than they were. There are some metrics that we use to determine how bad COVID is in our city. So how many people who tested for COVID are positive, that's percent positivity, that is decreasing, but it's still 9.1%. The number of cases that we're seeing per day, so we look at the daily average cases and we are still over 1,800 cases of COVID per day. That is still a lot. And hospitalization is decreasing, but we're still averaging about 39 hospitalizations per day for COVID. And unfortunately, we're still losing far too many people from COVID, which is preventable. So anytime I am a preventive medicine specialist, so it grieves me every time I see a number for a death that is preventable. So we are still suffering from preventable deaths from COVID. It is much better than before, so there's a lot to celebrate. However, I want to remind people that COVID is still a concern. There's still cases in our city. So these are some things that we can do to ensure that we are prepared, our communities are prepared, our friends and loved ones are prepared. One major tool that we have had in our response to COVID, it is not a magic bullet by any chance, but it is a very close magic bullet, and that's vaccination. And this is how we're faring when it comes to vaccination. This is a measure of how many New Yorkers are protected from severe COVID. And when you look at the coverage of at least one dose, we're doing pretty well citywide. At least 89% of all New Yorkers have received at least one dose of the COVID-19 vaccine, so that's good news. And for those who have completed their primary series, that means they have received at least 2 doses of a COVID vaccine in the last 2 years of the vaccine being available. That is 80%. So 8 out of every 10 New Yorkers have received at least 2 doses of the vaccine. That is impressive, and we're very excited that New Yorkers take their health and the health of their city seriously. Now, we know that with the vaccination, it is not one and done. This is a situation where every now and again, we need to update our protection with additional boosters. And when we look at of those who are eligible for an updated boosters, how many have received those boosters? Only about 40%. And you see that there is some variation across board when you look at it by borough, with most of those who have received their boosters still date in Manhattan. So we continue to keep an eye out on for our fellow New Yorkers. And this is part of that process, making sure that you all frontline workers have the talking points and know where to support the community. So let's start with a quick overview of this updated booster. Now, this booster is different from the other boosters that were available before. This is a new booster. So the Food and Drug Administration authorized both Pfizer-developed booster and Moderna bivalent COVID-19 vaccines for use as booster doses under an emergency use authorization. So we have a Pfizer booster and a Moderna booster, and these boosters are the new updated bivalent boosters. So it's different from the boosters we had from before. Now, the recommendation for this booster followed a comprehensive scientific evaluation and robust scientific discussion. The original COVID-19 strain is not circulating anymore. So the brand of or the type of the vaccine we had before was targeted towards the strain or the version of the virus that was circulating previously. And now that we have new versions of the virus, new variants, the FDA asks the manufacturers to update their shots to include shots that are specific for the type of variants we're seeing today. That's the BA4 and the BA5. Now, these bivalent boosters, what we mean by bi is it has 2 prongs to it. One prong that targets the old variant and another prong that targets the newer variants, and that's why it's called bivalent. So the new prong that targets the new variants targets the BA4 and BA5, the most recent Omicron variant. The booster, Moderna booster, is recommended for people who are 18 years and older, and the Pfizer bivalent COVID-19 booster for those who are 12 years and older. The boosters need to be given at least 2 months after receiving the last vaccination, either a primary series or a booster. So between your last vaccination, the last COVID-19 vaccine shot, whatever it is, you need to wait 2 months, and then you can get this updated booster. And it's available for everyone 12 and older, Pfizer, and then Moderna for everyone 18 years and older. The vaccines have similar safety profiles as previous monovalent vaccines. And now I will go into a deeper dive into some of the frequently asked questions about the updated booster. I will use the word updated instead of bivalent because I think that's easier for people to communicate. So for community members, using the word updated booster or bivalent booster will help people differentiate between this new booster and what we had before. So one question that we get often is, why were the shots updated? Why can't we just rest with this vaccination thing? The reason is simple. COVID virus is not resting. It keeps mutating. So we have to keep up with it. If your enemy is not resting, then you cannot lay back and give up. So the COVID virus continues to change. It has changed a lot from the original strain. So the shots were updated to keep up with that. The changes that the virus have gone through have made the virus better able to slip past the antibodies produced against the older versions of the virus. Either those antibodies were produced through a previous infection or through vaccines. Remember that the good guys are the antibodies. These are the ones that fight the germs, and the COVID virus is the bad guy. Now, the good guys are guarding your body, making sure that the bad guy doesn't penetrate. But now the virus has figured out a way to go past the antibodies and still get into the system. So we have to develop a stronger protection. And as a result, the virus has gotten better at causing reinfections and escaping the protection of vaccines. So we need to shore up our protection. We need to fortify the vaccines to make sure that they're not letting the virus go by. So the effectiveness of the monovalent vaccine has reduced. And this is a chart on my right that just shows that, over time, all types of vaccines lose their potency or their efficacy in keeping infections at bay. After, 200 days, you start seeing the effectiveness go down. So that's another thing to consider. So that's why the shots were updated. Now, another reason why the shots were updated is we need the shots to protect against severe disease that causes hospitalization and death. This is what we're solving for. The big problem is we don't want people on ventilators, hospitalized, taking up bed spaces, preventing other health services from being rendered because everywhere is occupied with COVID. We've seen that happen before. So we don't want that to continue. And we don't want people to die from COVID if it can be prevented. So the updated booster may also help reduce the spread of the virus. One, it can help prevent severe disease and hospitalization or death. Two, it can also help prevent the spread of the virus. If there are less people getting sick, then there are less people transmitting the virus. And if the speed of transmission is reduced, then we can also reduce the speed at which variants appear. So the United States has seen 5 Omicron sublineages since December, with increased transmissibility and capacity to evade the immune system. So we need a more effective way to slow the transmission of the infection to prevent these faster, more potentially more dangerous variants as they continue to emerge. So on my right, you see this purple chart. It shows you the current variants in New York City. So BA5, which is a sub-variant of the Omicron, is responsible for about 80% of the infections we're seeing in New York City. And the lighter purple or the pale color is BA4. That's responsible for about 20%. So these are the two strains circulating at this moment, BA4 and BA5, and that is what the new updated booster is targeted against. So who should get this updated booster? Boosters are recommended for everyone age 12 and older, as long as they have had their primary vaccination series. So let's say you haven't had any COVID vaccines at all. Can you start with the updated booster? The answer is no. You have to start with your first shot, your second shot. 2 months later, then you can get this updated booster. So that is the recommendation right now. The earlier mRNA shots are still the first 2 shots a person will get, but they are no longer authorized for use as boosters in people aged 12 and older. So if anyone is eligible for a booster, they will get the updated booster, not the old type of boosters. Those who are age 18 and older can either get Pfizer or Moderna. Adolescents ages 12 and older can get the updated Pfizer shot. Those who are older adults, the elderly, and those who have underlying conditions are most at risk of severe disease and should get the booster as soon as they are available. So when we look at who gets very sick with COVID, It is usually those who are older, 50 years and older, those who have underlying conditions. So we strongly recommend that if you fall into that category or you know people who do, please encourage them to get the updated booster, again, for stronger protection against this BA4, BA5 subvariants that we're seeing. Everyone needs a booster because the protection that they had from previous vaccination or previous infection will wane over time in all age groups. So it doesn't matter if you've had COVID before or I took 2 vaccines already, I'm done. This virus is such that after a few months, that protection is going to wane. So you need to update your protection. So everyone needs a booster. And so everyone should be informed that this is available for them. When should you get an updated booster? 2 months after your last vaccine shot. 2 months, wait 2 months, and then you go get the updated booster. For those who have recently recovered from COVID, the CDC recommends that you can wait at least until the illness has passed and the person is no longer contagious. So make sure that you've completed your isolation. However, the CDC has also recommended that it is okay to delay getting the booster for at least 3 months if you have just recovered from COVID. So 3 months after your symptoms have started, this is because infection itself already acts like a booster. So you will be protected in those 3 months from reinfection. Studies have shown that people who have a low risk of getting sick again for about 3 months after they recover. So if you've recently had COVID, you can afford to wait 3 months before you get the booster. However, you may not want to wait as long as 3 months if COVID-19 levels are already high in your community or if you have reduced immune function. So it is okay to wait for 3 months, but know thyself. If you're at high risk, you are exposed to COVID, or you have a low immune status, you may choose to go get your updated booster before 3 months is over. This is a summary of when you need to get your updated booster. So let's start with the primary series. Let's say you got your first shot and then you got your second shot. Then you need to wait at least 2 months and then you go get the bivalent booster dose. Now, let's say you've got the first shot and then you get the second shot and then you have received 1 booster. And that was me a couple of weeks ago. I already got my bivalent booster. So you got your first shot, you got your second shot, then you got 1 booster. Now, if it's more than 2 months since you got that last booster, you are eligible for the updated booster, so you can go ahead and get it. Now, there are some folks, especially those who are 50 and older or have underlying disease, they got their first booster, they got their first shot, they got their second shot, they got their first booster, they got their second booster, and they are still eligible for this updated booster, as long as they wait at least 2 months, and then they can get the updated booster. We also recommend that if you're getting your updated booster, get your flu shot at the same time. It can be co-administered. That's what I did. On Saturday, I got my updated booster and got my flu shot, and then did my chicken flap to make sure that my arm is not sore. And here I am talking to you, all good and dandy. So where can I get an updated booster? Now, there are millions of doses that have been shipped across the city. The vaccines are available at community health centers. They are available at hospitals. They are available at pharmacies. CVS and Walgreens already started offering the shots. Both chains are scheduling appointments online. So check online. CVS and Walgreens have the booster shots. Availability has also increased in recent times. So if you don't know where there is a location around you, please check out the vaccine finder. You just type in your address. This is how it looks on the screen, and then you have the option to see where there's COVID, where there's flu, and there's flu shot. And if you want to take both at the same time, just find a location that has both the COVID-19 and the flu shot, and you will be good to go. As with past COVID-19 vaccines, the shots will be available free of charge. So you will not have to pay anything out of pocket to get the shots. Now, where are the city sites for the vaccination? This is a list of the health and hospital locations where the bivalent booster is available. They are taking walk-ins and appointments at these health and hospital facilities. Please note that the boosters are also available through the at-home vaccination program for those who are homebound or those who are elderly. So if you're 65 and older, or you are homebound, or you have a disability, then you will be able to schedule at-home vaccination. So please remember to let community members know that that is an option that's available to them. This is the big question. This is what people worry about all the time. All these vaccines you're pumping into our systems, are they safe? Is it okay for me to take so many vaccines? The answer is an emphatic yes. The risk associated with mRNA vaccinations are very, very low. The side effects are very similar to what we have had before. The most commonly side effects are the pain at the site of the shot, redness and swelling at the injection site. You may feel tired, you may have a headache, you may have muscle pain for a few days. Some people may have joint pain, chills, or some people may experience swelling of the lymph nodes in the same arm of the injection, or some very few people, nausea, vomiting, or fever. Again, remember that this is a sign that your immune system is building up those antibodies, so please don't be worried. It lasts a couple of days and then you're back to normal. So these are the same side effects that was reported for the original type of boosters, and very similar to what the COVID vaccine primary series side effects are. Again, the most common thing you will expect is the soreness of the arm, and this is usually will start by the next day, and within a day you're good, back to normal. Should I be worried about myocarditis? So myocarditis is inflammation of the heart muscle, and very rarely some mRNA vaccines cause myocarditis or swelling on or around the heart. It causes chest pain. After more than 80 million booster doses given in the United States, the government safety surveillance system has received a total of 37 verifiable reports of myocarditis, 37 out of 80 million. So when we say rare, this is what we mean by rare. Myocarditis mostly occurred in younger men, 18 to 24. For every million doses given to men in this age, the CDC expects that about 10 will have myocarditis. So again, when we say rare, this is what we mean. For adolescents, about 11 cases of myocarditis for every million cases. So people who develop myocarditis or pericarditis responded well to medicine and rest and felt better quickly and can return to their normal activities after their symptoms improve. Is it worth the risk? I will say yes. With COVID, you know what you will get. With the vaccine, you know what you will get. With COVID, you never know. Some people get away with a mild case of COVID, some don't, and you never know. So I will recommend that please don't be discouraged. There are side effects, yes, but in the long run, prevention is always better than cure. To minimize the risk of myocarditis, which seems to be related to giving doses closer to one another, CDC recommends that booster vaccines be given at least 2 months after a previous dose. So this is one of the reasons why the recommendation is wait 2 months between your last shot and this new shot to reduce the risk of myocarditis. As of today, over 350,000 people in New York City have received this updated booster, and we're glad that all is well. We haven't heard cases of serious side effects. When can younger children get an updated booster? Right now, FDA has recently approved the updated booster for younger children. So the manufacturers are updating those boosters for younger children right now. Those children under the age of 12, the authorization was just issued around yesterday. We're waiting for the final word. Until those are ready, the best way to protect babies, toddlers, grade schoolers is to get eligible family and friends an updated shot. So you surround the children with vaccinated people, and then the children will be safe. For now, children ages 5 to 11 can only be boosted with the older single strain vaccines, but that's going to change very soon with the FDA authorization. So how do we know that this updated COVID vaccines work? The first is the track record. We have gone from a high of 800 deaths per day to less than 10 deaths per day. We have done something right. because this virus has gotten worse over time, but here we are with much drastically reduced hospitalization and death. So this is the way we stay out of crisis for this pandemic. So the same vaccines have now been given to hundreds of millions people around the world, actually billions of people. At the last estimate, at least 60% of the world's population have received at least one dose of the vaccine. So it is the same vaccine. So we have a lot of confidence in this vaccine based on those numbers. The updated boosters were made, manufactured, and delivered identically to the previous COVID mRNA vaccines that most of us have already got. So if you're worried, oh, I'm pregnant, oh, I'm breastfeeding, is it safe for me? The answer is yes, because it is the same vaccine as before, just tweaked to include a focus on the newer variants. The clinical studies done found that receiving a booster increased the level of neutralizing antibodies against the ancestral, that's the original strain of COVID, by 11-fold. So if you are protected against COVID by 1-fold before, receiving a booster increases your protection by 11-fold. This will increase a person's protection against symptomatic infection over the next 6 months from 50% to 86.5%. And it's even stronger when we look at hospitalization and mortality from COVID. So it is worth it. Variant-specific boosters worked even better than the original booster shots. After these shots, protection against symptomatic infection over the next 6 months rose to 90.2%. So this is what gives us confidence to promote these updated vaccines, knowing that if you get these vaccines, you are protected from symptomatic infection, you are protected from hospitalization, and you're protected from death in a stronger way than before. So I am going to end with these key messages. What do you need to tell your friends? What do you need to tell your family members, loved ones, neighbors, colleagues? These are the messages. The updated COVID-19 booster are designed to provide broader protection against the newer and more transmissible COVID-19 variants. They help to restore the protection that may have waned since your previous vaccination and infection. If you got your last COVID shot over 2 months ago and you are 12 years or older, we strongly encourage you to get the updated booster. The boosters are available all over the city, community health centers, hospitals, pharmacies, all over the city. And the good thing is when you go schedule your booster, ask them about the flu and get both at the same time. In addition to high circulating levels of COVID-19, influenza is expected to make a return this fall as it does every year. So why not get protected from both viruses? We urge everyone to get their annual flu shot along with their updated COVID-19 booster to stay safe and to keep their loved ones safe as well. So I will stop there and take questions from you all.
Thank you so much, Dr. Ige. This was a very informative presentation. I know that my fellow CHWs on the call are very grateful to have this info. We had a lot of questions come in through the registrations and also the live Q&A. I encourage everyone to use Q&A function to ask any questions, and we will try to cover as many as possible.
Yes.
So one of the questions we got is, after the bivalent vaccine booster, right, will there be any other boosters?
We have learned from COVID that there is no crystal ball to say, no, there will never be an updated booster ever again, because it depends on how the virus behaves. The expectation at the moment, from what we know, is that boosters will now become a yearly thing going forward, like the flu. So that's what we know at the moment based on the information we have at the moment.
Okay. Next question is, which shot is better for the adults? Is it the Moderna or the Pfizer booster?
From what we have seen over time, Pfizer and Moderna have both worked well in preventing infection, hospitalization, and death. So we don't recommend one over the other. This booster, it's one shot and done. So whichever one is available, you just go ahead and get it. So we don't recommend one over another. They're both good.
Okay. And if someone hasn't received the booster dose, right? And if the place near them is having a second booster, what should they do? Should they skip the first booster and get the second one, or they should get the first one first and then the second one?
Everyone should just go ahead and get the newest booster. So that's a recommendation now. So if you haven't started your booster series yet, just go for the updated booster.
Okay. Should the breastfeeding mothers receive the vaccine?
Yes.
The new booster.
Yes, please. The vaccines are safe for breastfeeding mothers. Actually protects the baby too.
Are there like any side effects for mothers and babies?
Very similar to what other people have, the soreness of the arm, achiness, headache, maybe. But other than that, the vaccines have been shown to be safe, both to the mother or the parent and the baby.
Okay. I mean, I recently looked at the data for deaths related to COVID-19 for 2020 and 2021.
Mm-hmm.
The data noted that like 70% of COVID-19 related deaths were in seniors 65 years and over. As such, shouldn't we prioritize vaccination in seniors, especially?
Yes. The seniors are our priority. They are the ones who are most likely to get sick, very sick or die from COVID. Yes, but we all need everyone to be protected. This is a scenario where as long as there's COVID anywhere, nobody is safe. So if the younger population is not vaccinated, COVID will continue to circulate and the pressure will continue to be on the seniors. So if we only vaccinate the seniors, there will continue to be transmission and the seniors will continue to be at risk. So it's best if everyone gets vaccinated, reduce transmission, and then the seniors are protected. So we are prioritizing seniors first, but the message is we all need boosters so that we are all safe.
Okay. Thank you. What is the recommendation for those who became severely ill after initial 2 doses?
For those who had severe reactions to the first 2 doses, we have noticed that with boosters, the reactions are not as strong. So the common reactions we see are, those kind of soreness, headache, feeling a little feverish. If you had those reactions, taking a pain reliever helps. But with boosters, we see that those reactions are a little less. I'll give my own example. When I got my first shot, I got the Moderna. 2 days, I had headache, I had fever. After the second shot. The first shot didn't really bother me, but the second shot, I had, the headache and I had to take Tylenol, but I was still able to go to work. With my booster, nada. I didn't feel anything. I had no symptoms whatsoever. So, so just letting people know that boosters tend to be milder than the reactions you had before.
Okay, that makes sense. What can we say to clients who are like tired of getting so many vaccines, and how should we like convince them like to get more boosters?
Yeah, if you're like me, I hate shot. I'm a doctor, but I hate to be on the receiving end of those needles. So I don't know anyone who actually likes shots. So this requires a lot of encouragement from your own internal encouragement, just encouraging yourself. I was like, oh my God, I need to get another shot. It hurts so bad. But just understanding how important this is to my own safety, to the safety of my family. I have an 83-year-old mother. I will not want, her to get sick. So the benefits outweigh the inconvenience. So it's just helping people to understand why this is important. We don't want to go back to that time where everything was shut down. And yes, things are getting better, but the only way to maintain the progress that we have made so far is to keep doing the things that work. If we stop and slow down, then we're at risk of things ballooning or boomeranging again. So it is inconvenient. We're all tired, but we just need to encourage each other a little and say, 5 seconds the shot is done and it's worth it.
Okay. As with the flu shot, will every doctor be able to give the booster to their patients?
That is what will like to happen. That's what we hope. But right now, not every provider has the booster shot because they have to register to be a vaccination site. Not all providers want to take on that responsibility, so it's not available everywhere, but isn't available in a lot of places. I can say, very confidently that most pharmacies will have it. So the usual places you go to get your flu shots will have the booster shots.
Okay, just to follow up with that, can they have both the flu and the booster shot on the same day?
Yes, please do it. It's easier, it's safer, it's just more convenient. Just do both at the same time. The flu shot tends to hurt a little more than the COVID. COVID is just a tiny prick. The flu shot, you feel it a little more, but taking both will not increase the discomfort. It will not increase the side effects. So it's okay to take both at the same time.
Okay, thank you. If one has received like 2 doses of Pfizer, can they have Moderna updated booster, or they have to receive the Pfizer?
Yes, you can get anyone. I got Moderna for my initial series, but I got Pfizer for my booster because that's what is available.
Okay. Does the bivalent vaccine protect against the long COVID, or it's just for like now?
Yes, long COVID happens when you have COVID. So if anything that prevents you from having COVID will reduce the likelihood of you having long COVID. So the short answer is yes, because we don't want people to get sick with COVID. And so if you don't get sick with COVID, then the likelihood of having long COVID is much, much reduced. So yes, the vaccine protects against long COVID.
Okay. With your professional experience and advice, what would you say to someone that is like afraid to get vaccinated?
Yes, as a doctor, we see that people struggle with a lot of health decisions. People are afraid of surgical procedures. People are afraid of many things, which is normal. And what we do is help people to understand why this is necessary and what the benefits are to them. And what are the things that are important to you as a human being, and how will this vaccine help you meet those goals? If you have, you have your birthday coming up, you have your kids starting in college, you have young children who are going to start school, your kids are going to get married, you want to be there. You want to be there in good health. So this inconvenience will make it more likely that you're here and you're healthy for your friends, for your family, able to continue to work, able to continue to do the things you love. So those are the ways we just help people to grapple with this inconvenience of, dealing with COVID, dealing with vaccination. It's important to help us maintain the life like we know it and enjoy the things that we love to do.
Okay, thank you. When can we expect New York State and New York City to send guidance for the Pfizer 5 to 11 bivalent booster and Moderna 6 to 17 bivalent booster? The CDC just announced the EUA yesterday and stated that the monovalent booster is no longer approved.
That's correct. So we got that news yesterday. So as soon as we get the supplies, so once the EUA is authorized, then the Advisory Committee on Immunization Practices will meet. Once they also say yes, then the vaccines will start to ship. And within a week, usually, it will be available in the city. So we hope that in the next week or so, we should be able to have supplies. So please keep an eye out, and you will get some updates on when the vaccines are available.
Okay. Is there any publicity for the bivalent boosters in like the subways or the buses, or is there like a flyer or a resource where like we are educating the community?
Yes, we have some publication materials on TV, on radio, on the palm cards, social media graphics, Twitter, all of those things, just, helping people know that the bivalent boosters are available. Today, for instance, we're seeing cases ticking up in Staten Island, for instance, and we just send our communications to all of our partners. Cases are increasing in Staten Island. That is not a good sign. Please, everyone, get your updated booster. In fall every year for the last 3 years, we've seen a rise in cases. So this is the time to get your booster ready to weather the fall and winter season when we tend to see more respiratory infections in the city. So yes, if you need resources, I'll put the link to our website there so that you can see what's available that you can share with your network.
Okay. How do like the homebound and elderly people like register to get the at-home vaccine? Is there availability for that now?
Yes, I will put the link in the chat as well for where people can get information. But you know, you can register online and you can call to get information on how to register for their home vaccination.
Okay, that makes sense.
So
How
I'll put it
long?
in the chat.
Okay, thank you. So how long will it take after getting the bivalent booster to our body to have like the maximum antibody protection?
So for the COVID shots, it takes about 2 weeks after you get the shots for the antibodies to fully develop. So your body gets the signal, it gets a message, start developing antibodies, your body starts processing that signal and starts to cook up the antibodies and produce the antibodies. And it takes about 2 weeks for that to reach the desired level. So that's the same for the boosters.
Okay. What is the timeline for Moderna to be available for 12 years or older?
I'm sorry, can you take that question again?
The timeline for Moderna to be available for like 12 years or older kids.
It will depend on their clinical trial and how quickly the data is submitted and reviewed. So the process for this is you need to do the trial, then you need to share the data, and hundreds of people need to review the data and agree with you that this actually works the way you say it works, and then the FDA approves, and then we'll say, yes, you can use it. So Moderna, I think Moderna has submitted their paperwork and the review is going through. So once that's approved, we should have it pretty soon, usually not far behind Pfizer.
Okay. And if somebody had COVID recently, will the bivalent vaccine offer additional protection? Or
Yes. Yes, if you had COVID recently, you can wait 3 months before the updated booster. A recent infection with COVID will offer you protection for at least 90 days from reinfection. So you can afford to wait 3 months instead of 2 months, and then you can go get a booster.
okay. And if somebody was tested positive for COVID, right, and their test still shows 2 lines after 10 days as the isolation period suggested by CDC, can they still transmit the virus to others even if the virus count level may be low?
We haven't seen that is the case. Sometimes COVID, the test remains positive, but we haven't seen that means the person is infectious. So the recommendation from CDC is we're not using tests to determine who's infectious. The data reveals that usually 5 days after the infection start, you are no longer infectious. So even if the test is positive, you are not considered infectious after day 5. We encourage people to continue to wear their mask if they have to go out. So that's the latest recommendation.
Okay, thank you. Is there anyone who should not be taking this booster?
If you had a severe allergic reaction to COVID, by severe allergic reaction, we mean anaphylaxis reaction. That means you had difficulty breathing, your face got swollen, you had hives or a rash all over your body, and you couldn't breathe. If that happened, then do not go get this booster. Some people have other kinds of smaller reactions. Everyone who gets a shot is observed for about 15 minutes to be sure they're not having a reaction. So if you had a severe reaction in the past, then you should not get the booster. Other than that, we don't have any other contraindications. So whether you're on medication or you have an underlying disease or you're pregnant or you're breastfeeding, you can get the booster.
Okay. Have the bivalent booster presented different adverse reaction in patients? Like, did you notice like any people that have been like hospitalized after having the bivalent booster?
Not to the best of my knowledge. And the way we know this is anyone who gets a reaction to the vaccine can report through the vaccine adverse event reporting system. And if there are severe reactions to the vaccine, providers are mandated to report it. And that is tracked. So to the best of my knowledge, I haven't heard that, people are getting so sick that they were hospitalized as a result of the booster or the vaccines. Severe allergic reactions happen, but they're very rare.
As a CHW, I have noticed like people feel like they got enough vaccines and then they're not ready for the bivalent booster. What's like the best way to address that concern?
Yes, is meeting people where they are, acknowledging that it's normal to be tired of this, and we as human beings just want this to be over. But as human beings and as part of our self-care, we also need to look around for what threats are around us and to protect ourselves from those threats. Generally, as human beings, we want to do what is best for ourselves and our loved ones, and we want to lean into that desire. How can I keep myself safe from this virus? The best tool we have right now is the vaccine. So we are tired, we want it to be over, but the COVID virus is still here. So we need to protect ourselves from this, threat. And the best way to do that is to get vaccinated. So just, acknowledging that it is okay to be tired, but, helping people to process why it's important to stay safe by getting vaccinated.
Okay. Is there any incentives that city is providing for these boosters, or?
We are exploring what options are. Right now, we don't have much in the way of incentives like we did in the past with monetary incentives. Our incentive right now is just, we love getting our city back. We love being able to be out and not having to be cooped up in the home all the time. So we're encouraging people to please remember, we want our city back, we want our lives back, and this is how we do it.
Are like the both Pfizer and Moderna bivalent boosters equally protective, and are they equally available, or?
Yes, they're equally available. They're equally protective. Availability may differ. Most providers don't have both. Most provider will have one or the other. But we encourage people, whichever one is available, get it. I went to a Walgreens that was closest to my house. They had Pfizer. I got Pfizer. Even though I had Moderna before.
That's good. If somebody has like a heart condition or like they have diabetes, should they take this booster, or what?
Oh yes, please. If you have diabetes, you are at a higher risk of severe illness. If you have heart disease, you are a higher risk of getting sick with COVID. So you want to make sure you're protected, and the booster is the best way to do that now. So please don't hesitate. If you have an underlying condition, if you have diabetes, if you have high blood pressure, if you have severe asthma, if you have chronic lung disease, you need to get this booster, because this is, those people who have those medical conditions can get very sick with COVID.
How much more effective are bivalent boosters versus the previous other boosters, and how long do you think they last?
Right now, it's been studied for protection lasting up to 6 months. Again, and over a 6 months period, the new updated booster provide up to 90% protection from infection and even higher level protection from hospitalization and death. So they were pretty good. And they are superior to the previous booster. The previous booster provide up to 80 or so percent protection, and now this one's are like 90% protection.
Thank you. What role do you think NYC should play in addressing COVID globally and vaccine inequity?
One thing that we have seen with the pandemic is that it was a common enemy, and for the first time, you see people come together as a global family to fight this pandemic. And that included scientists sharing information, sharing data on what works and what doesn't. and also providing support across technical assistance across jurisdictions and support. So New York is a city of is a melting pot. People are here from different all over the world, and people have families and friends all over the world. So we have, invested in some global vaccine equity conversations with the World Health Organization to ensure that as people come to United States, those countries, we want them to be able to access vaccines. We want people to have access to information that they need to stay safe, because we are all connected. As long as other countries surrounding us, or where our families, those of us who are immigrants, are from, if they're not vaccinated and COVID continues in those places, it's a matter of time it's going to come here. So New York City, you will see in a lot of publications over the last few months advocating for global vaccine equity to ensure that the resources we have here are also made available in other countries.
That was our last question. Thank you so much, Dr. Ige, for this informative info like you presented to us. Thank you for sharing this with us.
Thank you, Garvinda, for moderating, and thank you everyone for being such an engaged audience. So many rich questions.
Thank you so much, Dr. Ige and Gurvinder. What a great presentation. So many questions answered. Always a pleasure to have Dr. Ige do our webinars for the community health worker audience. I also want to give a thank you to our team at the Community Health Worker Research and Resource Center, our support team from New York SEAL and the PRC, and of course, DOHMH. I'm going to launch a poll right now. Please, audience members, please respond to this poll. It helps us to know if we're doing a good job, if our presentations are helpful to you in your work, and yeah, these responses help us understand how we should move forward with our programming. So again, thank you so much. And please stay tuned for the recording and the slides. I will be emailing those out at a later date. And I hope everyone stays safe and healthy. So thank you.